According to doctors, stroke happens when the blood supply to part of the brain is cut off. As a result, brain cells can be damaged or even die. Stroke can cause damage, including partial paralysis of the limbs, difficult tripping or holding things, speech impairment, and slowed ability to communicate. The damage can be short or long term, depending on what part of the brain is affected and how quickly it is treated. 57-year-old Ben Alioni developed serious fever in June while in Arua. He reported to a clinic for treatment but did not realize that he had what was developing into a stroke.
So in the course of treating this fever, the second injection given to me made all my body to derail. By that time, I could not even lift my fingers, not even my lower limbs, the legs. I could only lie on my back, not even turning on the other sides. I knew this is nothing other than stroke.
Alioni was transferred to Mulago National Referral Hospital, where he spent a month on treatment. On discharge from Mulago, he was asked to take up physiotherapy. Since then, Alioni has been undergoing stroke rehabilitation for 4 months at the Stroke Rehabilitation Center in Wampewo along Gaza Road. Today, Alioni struggles to get up on his own and stand, but he's able to walk. He says the journey back on his feet requires much patience.
The first machine, which uses electricity, is to strengthen you up, to give you from a lying position, to give you that if you can stand on that machine, then you will gain strength enough. So the second machine is this manual one, where you can go there, it strengthens your knees and the chest. So these positions made me to strengthen up. Actually, there are these two positions which made me thoroughly strengthened up. If it is a serious matter, you must take at least 2 weeks on one machine. One position must take 2 weeks.
According to Ibrahim Bukenya, a principal physiotherapist and managing director of Stroke Rehabilitation Center, 250 stroke survivors were received at the center in 2021. However, the number is likely to be slightly high this year.
We have so far collected from January up to October. We have so far seen 221 patients. So this shows that by the end of the year, the numbers might escalate than the numbers we saw last year. And the numbers, they might take, and these are not only the numbers, because this is a private center whereby patients have to pay some little money to be attended to.
According to Winnie Nabagala, a rehabilitation nurse at Stroke Rehabilitation Center, rehabilitation is a rigorous process that requires passion, love, commitment, and patience.
It's all about skill, profession, and a love to serve.
Bukenya highlighted the success rate of the rehabilitation.
The success rate we have registered, I must say that we have registered almost 50% of our survivors. Most of them have returned back to meaningful life. They have had children. They are doing their activities. They are benefiting their community. So 50% of these survivors have recovered, and 50% of them are still on their way.
However, stroke survivors expressed a dire need for similar rehabilitation services to be extended to different parts of the country for accessibility.
We are here. How about those ones who are in the village, who don't know what to do, who don't know how this stroke attacks them?
Globally, 1 in 4 adults over the age of 25 will have a stroke in their lifetime. 12.2 million people worldwide will have their first stroke this year, and 6.5 million will die as a result. The incidence of stroke increases significantly with age. However, over 60% of strokes happen to people under the age of 70, and 16% happen to those under the age of 50. Winnie Nabagala, a rehabilitation nurse at Stroke Rehabilitation Center, highlights the main clinical risk factors for stroke.
High blood pressure, high glucose levels in the body, and even high cholesterol levels. It's not that stroke, it attacks only the elderly people, but even us, you can get it if you don't control yourself, especially on stress.
Other risk factors include tobacco use, physical inactivity, unhealthy diet, harmful use of alcohol, raised blood lipid levels, obesity, genetic disposition, stress and depression.
Avoid certain few things. Avoid like even eating habits. Avoid drinking. Avoid smoking. Be sober. Avoid stress. Don't involve yourself in other things where you are going to overthink your brain off and then you get stressed up.
Knowing the signs of stroke and seeking immediate medical care can save lives and improve the outcome for survivors. Patrick Senyondo, NTV.